Good afternoon, and welcome to the National Press Club. My name is Richard Ryan, and I am Senior Washington Correspondent for the Detroit News and President of the National Press Club. I'd like to welcome club members and their guests in the audience today, and those of you watching on C-SPAN or listening to this program on National Public Radio. The video archive of today's luncheon is provided by Connect Live and is available through the National Press Club website at press.org. National Press Club luncheons are also carried live by many sites on the World Wide Web. Press Club members may also access transcripts of our luncheons at our website. Non-members may purchase transcripts, audio and videotapes by calling 1-888-343-1940. Before introducing our head table, I would like to remind our members of some future speakers. On Monday, April 23rd, David M. Walker, Comptroller General of the United States, will be our guest. And on Wednesday, April 25th, Dale Petrosky, President of the Baseball Hall of Fame, will be here at the Press Club. And on Friday, April 27th, Angela Perez Baracchio, Miss America from Hawaii, will talk about character education at the National Press Club. If you have any questions for our speaker, please write them on the cards that are provided at your table, and please make sure you write legibly so I can read it, and pass them up to me, and I will then ask as many as time permits. I'd now like to introduce our head table guests and ask them to stand briefly when their names are called. Please hold your applause until all head table guests are introduced. From your right and my left, Brett Lieberman of the Harrisburg, Pennsylvania Patriot News. Sean Martin of WebMD. Stephanie Woods, Nightly Business Report. Greg Gilbert, Washington Bureau Chief of the Milwaukee Journal-Sentinel. Lisa Richwine of Reuters. Harry J. Pierce, Vice Chairman of the General Motors Corporation and Chairman of the Board of the Merrill Foundation. Miss Mary Knockreiner of Wisconsin. Ms. Knockreiner is the mother of Kelly Knockreiner, an organ donor and the catalyst for the Wisconsin Organ Donor Program. Frank Ockefer, co-chairman of the Speakers Committee and a former president of the National Press Club. And skipping over our speaker for a moment, Ms. Catherine Skiba, Washington correspondent for the Milwaukee Journal-Sentinel and the member of the Speakers Committee responsible for arranging today's luncheon. Thank you, Catherine. Richard Shoemaker, UAW Vice President and Director of the UAW General Motors Department. Emily Murray, Producer, CBN News. Larry Lippman, Palm Beach Post, and a former president of the National Press Club. Bill Walsh of the New Orleans Times-Picayune. Thank you. When President Bush tapped Tommy Thompson to become the 19th Secretary of the Department of Health and Human Services, the Wisconsin governor was then the longest-serving governor in the United States. He had been in office for 14 years and seemingly could have been there forever. He appeared to have the same enthusiasm for the job when he left as he did when he first arrived. But he gave up the job he enjoyed and left the state he loved to answer President Bush's call and came to Washington, a city he once referred to as Disneyland East. As HHS Secretary, Governor Thompson oversees the department that has more than 63,000 employees and a budget of $429 billion, making it larger than all but a handful of countries. HHS is the nation's principal agency for protecting the health of all Americans and providing essential human services, particularly for those who are least able to help themselves. Its many agencies and programs include the National Institutes of Health, the Food and Drug Administration, the Centers for Disease Control, Medicare, Medicaid, and Head Start. As governor, Mr. Thompson gained national recognition for his leadership on welfare reform, expanded access to health care for low-income people, and his educational initiatives. His Wisconsin Works Welfare to Work legislation, enacted in 1996, served as a national model for welfare reform. He also created the nation's first program allowing parents to choose a school for their children. Other than a certain governor from Texas named Bush, Governor Thompson last year may well have been the best known and most recognizable governor in the country. He won Governing Magazine's Public Official of the Year award in 1997. In that same year, he won the Horatio Alger Award, given annually to the outstanding American whose success and commitment to helping others serves as an inspiration to America's young people. And just yesterday, Marquette University unveiled plans for a $10 million Tommy G. Thompson Center for Excellence in Education. In announcing Governor Thompson's appointment, President Bush called him a leader and an innovator, conservative, compassionate, and creative. Governor Thompson was born in Elroy, Wisconsin. Elroy is a town so small, the governor once said, you can call somebody on the telephone, get a wrong number, and still talk for half an hour. He studied history and political science at the University of Wisconsin in Madison and went on to get a law degree there. He worked his way through school at a variety of jobs, including road construction, as a clerk, as a legal assistant, and as a bartender and bouncer. He was 25 years old when he ran for and was elected to the state assembly. He served in the legislature for 20 years before winning the governorship. Governor Thompson thought seriously of running for president in 1996. He made a couple of trips to Iowa and New Hampshire and then decided against it. In an interview with a Wisconsin newspaper earlier this year, Governor Thompson called his decision not to run in 1996, quote, a big mistake. If he had run then, he said, he would have been a creditable candidate last year. But when he looked at running in 2000, he decided Governor Bush was so strong and had so much money, it would be useless. Governor Thompson, now 59, is known for his high energy, for speaking his mind, and being a good, old-fashioned, shoe-leather campaigner. He's been called a natural-born politician. So please join me in welcoming to the National Press Club the natural, Tommy G. Thompson, the Secretary of the Department of Health and Human Services.
God almighty. Richard, thank you so very much. I'll tell you, that was, I should just say amen and sit down. I'll tell you. Thank you very much for your introduction, and thank you so very much for having me here today. I certainly would like to thank Catherine Skiba of the Milwaukee Journal and Frank Alkoffer, Chairman of the Press Club Speaker Committee, and Craig Gilbert over here, all from the Milwaukee Journal, for inviting me to be here. I thank them all. They're wonderful people, great reporters, and I'm delighted to be able to be associated with them. And I want to thank all of you for coming. I appreciate this very much. Today is a very exciting day for me. I'm very passionate about organ donors and organ procurement and the opportunity that it gives. So I'm very happy to be associated at the head table with Harry Pierce, who just gave a dynamic speech this morning over at the Department of Health and Human Service about donorship. He received some marrow because he had leukemia, and he just is vice chairman of General Motors, and to hear him speak about the importance of that, you know, it brought a tear to my eye, and I just want to say thank you to him. And Mr. Richard Shoemaker teamed up with General Motors, Ford, and Chrysler, Daimler Chrysler, to be the first international union to come together and actually negotiate and receive an agreement in the contract to be able to promote organ donorship, and I thank them very much. And Mary Nachreiner, who is a very good friend of mine from Wisconsin. But it was many years ago that Benjamin Franklin, he wrote in his autobiography about his brother starting a newspaper in Boston. The year was 1720, and the newspaper was then only the second one to appear in the colonies. Apparently, as Ben Franklin pointed out, many of his brother's friends tried to dissuade him from starting such an enterprise. They said, one newspaper, and I'm quoting here, one newspaper being in their judgment is enough for America. My, how things have changed. And I have to say I'm glad they did. It would have been a very lonely lunch here today at the National Press Club. Americans love their news. They seem to be getting more and more of it every day, thanks in part to many of you here in this room. And thanks to the unbelievable advances being made in communications and technology. Medicine has, of course, advanced over the years as well. From almost the beginning of time, our expectations of medicine have been the same: to recognize an ailment, explain it, then make it go away. And from almost the beginning of time, we have been unable to do any of these things until less than 100 years ago. The very idea that a disease could be turned around by treatment was then the realm of dreams. The transplant capabilities we take for granted today would have astounded someone from Benjamin Franklin's time, indeed someone from any time over the ages. It is truly one of the great medical success stories of the 20th century, and yet it is one that is severely limited by the availability of donated organs. When I was governor of Wisconsin, I was aware of the tremendous advances being made in organ transplantation, because I knew our own University of Wisconsin Hospital was doing a lot of the work and research in that area. But the dire need for organs was brought home to me one night when I invited Dr. Hans Solinger, who was with us, and Dr. Tony D'Alessandro, the two outstanding nationally and internationally renowned transplant surgeons, to be with me today. And they came to my house for dinner, and they brought one of their patients, Horst Foster from Switzerland, who came over to Wisconsin to have a kidney transplant. And he was there at the dinner, and they were talking about how this man had heard about the University of Wisconsin and how important it was to get a kidney so he could live. And he got up and talked about it, and he just, was so passionate about it that got me to thinking, what could I do as governor? And Dr. Solinger spoke to me that night about the desperate need for more organs and the need for a high-profile spokesman to lead the effort. So that night I made a commitment to him, to myself, and to Wisconsin to make organ donations a priority, to articulate a vision for our state, and to make a concerted effort to get more people involved and to recognized for giving organs. And that is exactly what we did. On my first day as Secretary of Health and Human Services, I said that I would make that same commitment to organ donations on a national level within my first 100 days in office. And I'm here today, 75 days later, to do just that. And I thank you for giving me this opportunity. Today, appropriately, enough during National Organ and Tissue Donor Awareness Week, we make this announcement. We're launching a new national initiative to encourage and to be able to enable Americans to donate life. This initiative will encourage organ and tissue donations, as well as registration for marrow donation and the donation of blood. I'm announcing 5 initial parts of this initiative today, but I want to be very clear that this is only the beginning. My commitment to this issue will not waver. It's too important. There are currently more than 76,000 Americans on the national waiting list for organs, and that number grows by more than 300 people each and every month. Last year alone, more than 5,500 patients died while waiting on the waiting list. That's 15 people each and every day, or 1 person every 1 hour and a half. The need for organs for transplantation is increasingly outstripping the supply. 10 years ago, about 15,000 organs were transplanted, while the number of people on the waiting list totaled approximately 22,000. Yesterday, our department announced that 22,800 organs were transplanted last year, which represents more than a 50% increase over a decade ago. That's encouraging news, and you should be happy about that. But while transplants have grown 50%, the waiting list has grown by 250%. The number of cadaveric donors actually increased 2.7% last year to almost 6,000. Well, this is gratifying, and it means we're heading in the right direction. It is not even close to what we need in America. This great, compassionate country can do better. And what I know we can achieve if we truly dedicate ourselves to letting people know the need is there and what they can do about it. Our goal is within this initiative is to get the information out there, encourage families and all of you, all over America, to understand the importance of organ donation and to grow the number of donors. If we can accomplish this, then so many of the challenges we face today involving organ donation will be solved. Disputes over allocation between different states and different regions of the country will be a thing of the past, and fewer people will die while waiting for an organ, and that will be a great legacy to leave for all of us. The first part of this initiative is a workplace partnership for life, which we announced at the department this morning. We kicked it off with an event, and we had several speakers. Representatives from 18 different companies and organizations were there. Everyone from Verizon Telephone, Bank of America, to the United Auto Workers and the United States Postal Service. And many of these people are here with us today, and I thank all of them for coming. And I personally cannot thank them enough for welcoming this opportunity to embrace life for themselves, for their employees, and their employees' families. The aim of this campaign is to provide employers of all sizes and their employees with the opportunity to be able to create a nationwide network of donation-friendly workplaces, organizations that give people the information, the encouragement, and the chance they need to donate life. You've heard of the United Way? Well, think of this as the donated way, a chance for people to act on their own good intention throughout the workplace. Harry Pierce is here. He's the vice chairman of General Motors Corporation. He is also a bone marrow transplant recipient, having been diagnosed with a very acute, fast-growing leukemia. And he's already taken a leading role in working to be able to create the donation-friendly workplaces around his company, General Motors. We're excited that he has agreed to continue his efforts along with us. And the fact that he is joining us gives me a pretty good feeling about the kind of successes that we're going to be able to see. He has teamed up, as I have indicated, with Richard Shoemaker from the United Auto Workers. And in their most recent labor management contracts, the UAW and the big three automakers made provisions in the contract itself to promote organ donation. It is a national model that I plan to strongly encourage other industries to consider and follow. And I want to thank the Coalition on Donation and the Merrill Foundation who are here. And I had the opportunity yesterday to call in all of the individuals dealing with organ donations and marrow transplants and blood donation into the department. We had a wonderful meeting. And I thank all of them who are here for their help in launching this partnership and for all the work they do to educate the public about the need for organs, marrow, tissue, and blood donations. And I want to emphasize once more that this initiative is focused on all the donations, whether organ, marrow, tissue, or blood. We need them all. Every day in this country, there are about 32,000 life-saving blood transfusions taking place, and only 5% of us in America give blood, only 5%. But every day there are also thousands of people who are waiting for tissue transplants, and every year more than 30,000 people are diagnosed with leukemia and other blood disorders, 2/3 of whom will not be able to find that life-saving marrow donor within their own family and will have to turn to the National Marrow Registry to find a matched donor. It's so easy to sign up. The Workplace Partnership is dedicated to helping all of these people all over this great country. The workplace is one of our best hopes for creativity and participation when it comes to organ donation. Every one of us has a contribution to make, from the big corporations to the unions to the Joe Pizza on the corner. This morning alone, hundreds of people at HHS signed new donor cards. And guess what? I did as well. And part of the new workplace initiative materials we released today is this new simple model donor card. Now, many versions of donor cards exist today, and they're still very valid. Whatever you do, don't throw them away. This card is not meant to replace other cards, but is to serve as a model. Building on our experience and incorporating elements that we've learned are needed, such as a line to designate whether all the organs and tissues may be donated or just some. And the two most important lines on this model card, however, and they're included on most organ donor cards, they're out there today. And those two lines are for signatures by two witnesses, preferably family members or others most likely to be contacted in case of an emergency. I cannot emphasize enough how important it is to talk to your family. For example, police sometimes carry identification documents away from the scene of an accident. If our families don't know our wishes, then how will they be able to make such a difficult decision at such a traumatic moment? And that's why it is so important that we tell our loved ones now. And that is why this new model card incorporates the proven element of two signature lines, in order to help ensure that families and hospitals know that an individual's wishes, we need to take a look at other options as well. That's why we're looking at organ donor registries. 16 states have now established donor registries, and consensus seems to be growing that registries can provide a means for assuring that a donor's intent is recorded and retrievable whenever necessary. However, many questions remain about the most effective registry techniques. Whether we need a national registry is truly a question. Or what is the best way to link existing state registries? This is a discussion that we're going to have in the department. We're going to bring all of the groups together to discuss whether or not we should push for a national registry. We need to figure out what works, which is why I've asked the Health Resources and Service Administration, HRSA, to immediately organize a national forum on the potential of donor registries, a forum that will include the National Governors Association and the National Conference of State Legislators to assist us in reviewing the potential and the effectiveness of donor registries in all the states. Helping individuals make the choice for donation truly is the first step. The next step is helping to ensure that families and hospitals have access to that decision when the opportunity for donation may arise. Did you know that family refusal is the most common reason that organs from potential donors are not recovered? National polls indicate that close to 95% of all Americans are willing to donate their organs if they are asked. And yet only half of families say yes when they are approached. If we can increase consent for donation, that alone could be one of the most truly remarkable outcomes of this initiative. And I am convinced that we can all make that happen. Losing a loved one is an unimaginable and wrenching loss. But donating part of a loved one's body to someone else can bring incredible comfort to donor families. I know this from firsthand experience with many of the families in Wisconsin. Soon after I committed to making organ donation a priority in our state of Wisconsin, someone came to me with a design for an organ donor medal. We decided that it should be like the Olympic medal, because it's just as important and probably more important to that family, to that recipient. And so we called it the Gift of Life Medal. And in the 6 years that followed, we held a ceremony each year, either at the state capitol or at my residence, to recognize and to celebrate those families who made the decision to share life. I got to be honest with you. Those were the 6 of the toughest, most emotional events that I've ever participated in. Some of you know I'm Irish, and I tend to get a little emotional. And believe me, the tears started flowing almost immediately. And every year, my tears, the family tears, the recipients, the audience, my hard-boiled staff, everyone, there wasn't a dry eye in the crowd. But I am convinced that donor recognition for the family that gave so much is absolutely crucial to encouraging organ donation. And the simple fact of the matter is that we owe our thanks and recognition to every family that suffers such a great loss and gives such a tremendous gift. So I'm supporting efforts to create a national medal recognizing families all over America who consent to donation. And I pledge today to have a medal program in place by this time next year. I'm also announcing that the Department of Health and Human Services will create a model curriculum for states and counties to incorporate organ donor information into their teenage driver's education classes, again working with states and local school districts. The driver education approach also stems from someone and something we did in Wisconsin. a law inspired by a young lady named Kelly Knockreiner, and her mother's here today. She was a teenager, far advanced for her years, who was killed in an automobile accident soon after she received her driver's license. But before she died, Kelly had signed the back of her driver's license, a selfless decision that allowed her to become an organ donor and saved the lives of 2 people from Wisconsin and a woman from Kansas. Now, Kelly's parents wanted to make sure people would remember and follow their daughter's generous act. So they pushed for a bill that would require every student attending a driver education class to receive at least 30 minutes of instruction relating to organ and tissue donation, a bill that I went to the Knockreiner community and signed into law. In an effort that is helping all Wisconsin teenagers learn about the importance of organ donation. It's an effort that I would like to expand in every state across this country. Kelly's mother, Mary, is here today. And she has become just a tireless and a very visible spokeswoman on the issue of organ donation. And I'm so happy she's here today. For Mary, for Harry Pierce, who is here, and I wish you had a chance to hear him tell his life story, much better than mine. And for Richard Shoemaker, for everyone here today, this is only the beginning. I intend to expand this core initiative in the months to come. We plan to review the potential federal responsibilities for monitoring living donations, which has in recent years become the fastest growing source of transplanted organs. You don't have to die to contribute. You can sign up and be on the registry for marrow transplantation, and the executive director is here today and would love to have you sign up. And for donors and transplant patients alike, part of your lung, one of your kidneys can be transplanted. We at HHS need to ensure the safety and effectiveness of such procedures. The President's proposed budget that was released last week includes an increase of $5 million. It's an increase of 33% in funding for transplant and donation activities and the Health Resources and Service Administration. This is good news, but all the good ideas for promoting organ donation will not occur only to me or to others involved in this initiative. We need ideas and the inputs from all of you who are dedicated to this issue. And that's why I'm so pleased that my department is able to announce today the availability of $3 million in new grant funds to support demonstrations of innovative new approaches to increasing organ donations. Obviously, this is an issue that I am very passionate about. But how can you not be? It is an issue that is so simple and yet so important. As one woman said, why put organs in the ground when they can save someone's life? Why hesitate to donate when no one hesitates to receive? One organ and tissue donor can actually help up to 50 people. One person's heart can beat for someone else. Their lungs can breathe for someone else. And if your organs had a chance to vote, don't you think your eyes would vote to be able to continue to see the beauty of this great land? And your heart would vote to continue to beat in somebody else's body? And the beautiful kidney and liver, don't you think they would love to continue to enjoy that great Wisconsin cheese and milk? Bones can give mobility. Skin can give renewed hope to a burn victim. I don't want you to die, and I'm not here to ask you to do any of that. I do want you to sign your card. I want you to talk to your family, and I want you to make your intentions known. Because you never know who you could be helping or who could be helping you. And no group is more well-positioned to get this important message out than you, the media. So that's why I came here. I came here to seek and appreciate your partnership in this endeavor as well. There's an old Indian proverb that says, all that is not given is lost. This is especially true when it comes to organ donation. A gift that is never taken for granted, that is never forgotten, that proves beyond a doubt that out of tragedy can come hope, out of death, new life. Don't let the chance to say yes to life pass you by. I also have with me a very good friend who is a Deputy Surgeon General, Dr. Ken Morsugu, who 8 years ago lost his wife. And he and his wife had discussed organ donation. And he was able to help several families after that tragedy. And it brought, you know, a sense of relief of being able to help somebody else. 4 years later, 4 years ago, as a matter of fact, his daughter crossing a street was struck and killed. And he donated his daughter's organs as well. No family should have to go through two tragedies like that, especially a husband and a father. But Ken is one of the most passionate, most avid spokespersons for organ donors in the country. And I'm very pleased that he's an employee at the department. And I wish you would just stand up so we could recognize you, Dr. King. So organ donors truly have a face. And it's a life that you are able to save. And what is the best gift that you can give is the opportunity for somebody else to live. And that's why I'm passionate about this. And that's why I'm here today to spread the message, start this new initiative, and hopefully encourage all Americans to become better educated about this problem that we're having, a problem that we can solve together. And that, to me, is the American way. Thank you so very much.
Thank you. We do have a few questions here. The first one just asks, do you think the current organ donor system is fair? It says, can you explain the disparity in organ placement, where the rich and famous seem to get organs more quickly than others?
I don't think that's true. I think there's a lot of myths about organ donation. It's, I'm sure you can probably find one example or two, but the vast majority of people are treated very equitably and fairly. You're on a list, and the doctors know that that you need the organs, and they're not going to put somebody in advance of somebody else. It's very fair throughout the country. But there are some distribution problems. There's no question about that. Several states do a better job, and other states are not doing enough. And instead of arguing over the distribution problem, which is a very contentious subject, and one in which divides the whole organ donor community, my job, and yesterday we had such a wonderful meeting in the department. I invited them all in, and most of the people there, and I think just about all of them, said it was one of the best meetings they've had, because we all talked as organizations in the department about getting involved in getting more organs, more marrow, more tissue, more blood. That's the salvation. That's the solution. And then those myths and arguments about only the rich and famous get the organs will be displaced once and for all, which truly is not a fact. It's not reality, but it is a myth, and we're trying to knock down those myths and get more people involved.
This question would like to know why you believe that a donor organ program should be a top priority in the Bush administration when over 40 million Americans do not have medical insurance and can't afford primary health care.
It's doesn't mean that we can't have a lot of issues. I have never been a one-issue person. We are fighting to get more health insurance. In fact, the President's budget has put in many different ways in which we get more coverage. One of those, of course, is by increasing the amount of money for community health centers. We have 3,200 community health centers in America, and we want to expand that by an additional 1,200 to 4,400. We're already ministering to 11 million patients in our community health centers in America. We want to grow that to 20 million, almost a 100% increase over the next 5 years. And those are the individuals that really need the primary health care. They're mostly in the poor urban rural areas that health care has not been made available. So the Bush administration is not only looking for organ donors, they're also looking to provide primary health care to the underserved and to those individuals that do not have health insurance. We're also looking for a way to expand individuals to be able to purchase health insurance by putting in a $1,000 tax credit for those individuals who are single and $2,000 for a couple to purchase life or health insurance. We know that that doesn't cover the full amount, but it goes a long ways towards defraying part of the expense. And the third thing is in the department, we're looking at ways to expand S-chip, like we did in Wisconsin, to be able to get more people covered by health insurance. So the Bush administration is not only interested in donor donations, they're interested in health care, they're looking at ways to reform a lot of programs that are going to improve the quality of life for all of our citizens. It truly is compassionate conservatism at work.
A couple of questioners wonder that since there are such a large number of people, 76,000 Americans, I think you said, on a registry list, that there'll never be enough human organs, and that perhaps the best way to go is through cell research. But that's a real problem with the Bush administration, isn't it? What's your position on that? Stem cell research.
Well, there's many ways we can look at this problem. There are 76,000 people waiting for an organ. But there's also, I don't know how many thousand, Jill, are on a marrow transplant. We have 4 million people on a marrow registry list, and we have several hundred thousand waiting for a marrow transplant. And so there are many different ways that you can do it. But there is no national registry list. 16 states have their own registry. And we're looking at ways in which we come together to get more states to have a registry list or possibility of having a national registry. We are looking for many ways to do that. Living organs, living giving, is the new way that we're approaching the problem. This happens to be the fastest growing way. As I've indicated, you can give part of your lung, part of your kidney, and tissue and marrow, and be able to give so somebody else can live, and you are able to continue your own quality of life. So there are many ways. My friend over here from Horizon received a kidney from his wife. Jerry and his wife Connie are here. Stand up, Jerry. That's his partner, his wife, and they... And you can see Jerry is not wasting away. I mean, he is, they're both very healthy. And this happens to be the fastest growing area in which we can have replacement of organs by living individuals giving part of their body and continue to do it. Research is another area, very important. And I'm passionate about research. And it's just not embryonic stem cells. There's adult cells that we're looking at. Just this past week, the Medical Society found that you could get the same out of placenta and cord blood. And so there's many ways to do research. And we're very, very much in the Bush administration looking towards research, as evidenced by the fact that the President put in $2.8 billion for expanded research at NIH. And this is the largest one-time increase NIH has ever received. So all of these things, we all have to work together. Research is part of it. Living organs and donorship is another. Getting on the marrow registry is another way. And signing your donor card is another way. So just a whole plethora of ways that we need to address this problem. So I need all of your help in all of these areas to get the job done.
If a mother agrees to donate an organ, should her child then move up on the list to receive an organ?
You know, this is a question because one of the hospitals is looking at that as a possibility. In fact, they've actually implemented it. And I cannot answer the question because, as I understand it, there's a question of of the law as to whether or not this is possible, whether or not that is actually getting paid for doing something which is illegal. And that is being investigated. So until that investigation is done, and I think we should wait and find out if that is something that the law allows. So I'm not going to answer that because the law is right now is being looked at to determine whether or not that's legal, and I don't want to get involved in that until that determination has been made.
Here's an interesting question just arrived. Would you favor on federal personal income tax returns an organ donor consent form accompanied by a $50 tax exemption for every signature? Innovative.
Everybody wants to get me in trouble. Yeah, I favor that, but I think it's a great idea. Whose idea was it? I asked for ideas, you came up with them. I like it. Yeah, I support that. Whether or not Congress would, I think it's a good idea. I may push for that and take credit for it. Yeah, thank you.
Well, we make policy here at the Press Club. This questioner wonders if HMOs, who the questioner says is taking over medical decision and patient care, will be willing to pay for these organ transplants.
You know, every HMO and every insurance company has different policies and different coverage, but you'd have to go to your HMO to find out if they do cover transplants. We cover some of it through Medicaid and through the federal government for people that are indigent, but it depends upon your health insurance company and your health insurance policy. I can't answer that until I had a chance to look at your policy, whether or not they would cover it.
This questioner notes that Wisconsin resisted a national organ donor program during the term of your predecessor here in Washington, Donna Shalala, and the state favored a regional or state approach. And how will this approach fare under your new proposals today?
I tried to answer that because, no question, I started a lawsuit. I didn't like you know, as governor of the state of Wisconsin, to have organs being taken from Wisconsin and transported to another state. It was, you know, it's an argument, and I stuck up for my state. And I felt that we were doing a very good job with the Knockreiners and other people, you know, to promote organ donors. And I wanted other states to follow Wisconsin and to get involved in that. And but that is being governor of the state of Wisconsin. Now I'm secretary, and I look at the nation as a whole, and I have to look at the nation as a whole and find out ways in which we can increase donors. I don't want to get into a fight over distribution or allocation, because it's very contentious. And my argument and my pitch is, let's work together. Let's solve the problem. Let's see if we can't get people, you know, to reduce that 76,000 so everybody has a chance, whether it be tissue, marrow, blood, or an organ. That's the answer. It's not taken from one to another or passing one law to take from one from another. It's getting the job done, increasing the amounts so that we can solve the problem. And that's my approach. And at the same time, I'm not changing the rules. There's going to be recommendations from the department coming up to me, but till those recommendations come, the rules in effect that have been passed in the previous administration, and all I'm trying to do now is go the next step and to elevate it, and elevate the discourse of the debate to the extent that why can't we solve the problem instead of creating more angst amongst ourselves who are working so hard to get people involved. And I think it's a better approach.
Shifting gears here for a moment, this questioner says that the so-called morning after pill, RU-486, is now undergoing a safety review. Do you think the pill will be approved for use by American women, and if so, when?
Well, it is approved. It's been approved and is approved, and it's not only RU-486. We review, you know, most of the drugs out there to determine if they're safe. And I don't think the question is correct, because RU-486 is not being actively reviewed right now any more than any other drug is for safety. And what we're doing is we're trying to make sure that all of our drugs are safe, whether it be for women or men. And that's a responsibility for the Food and Drug Administration, which is part of the department.
Well, how about tobacco? You think that ought to be safe? You said that your personal view is that the Federal Drug Administration be allowed to regulate tobacco as a drug. The President, I don't think, has come quite that far yet. Are you on the same page with him?
Boy, somebody wants to get me in a lot of trouble, I'll tell you. You know, I think that, first off, the Supreme Court has ruled in this area and has indicated that, that this is up to Congress. And I think Congress is going to have to act. If Congress passes the bill and the President signs it, we will regulate it pursuant to the legislation. And for my personal vantage point, I see nothing wrong with regulating tobacco.
Research hospitals continue to lose money. How concerned are you about research hospitals' financial health, and what steps should the administration be taking, and are they taking, to make sure that they remain viable?
Well, research, you know, any research is so important right now in America. I had the privilege of, in my capacity as secretary, of going up and spending a day on the NIH campus, and had a chance to interact with some of our great scientists and researchers up there. And I've said this many times, but I will say it once again. We are blessed in this country for having the best researchers and doctors and scientists in the world working for the Department of Health and Social Services, and in turn working for all America. And they are close, you know, for that breakthrough. I can't predict, and they can't predict, you know, when the breakthrough is going to come for one of those insidious illnesses that have been out there for a long time, whether it be cancer, whether it be AIDS, whether it be Alzheimer's disease, diabetes. But we are close. And it's that research that's going on at NIH that's so important. And the President recognized that, and that's why he's put more money into research, into NIH by $2.8 billion. And it's going to be up to about $24 billion. Of that $24 billion, about 75% of those research dollars go back to other research institutions, mainly to research hospitals. And so by the additional $2.8 billion, a lot of this extra money is going to go to research hospitals, which are going to assist them. And yes, I am concerned about teaching hospitals and research hospitals. It's very important. And we have to make sure that we continue to do that. And I know there's financial difficulties in a lot of areas. And we're looking for ways in which we can be of assistance to them. And through our research grants, we think we can be very helpful to them.
A couple of questions here that may have come from job applicants. It says, when do you plan to name an FDA commissioner and a National Institute of Health director? Actually, there was two questions about the NIH director.
We are interviewing. If you want to put in your resumes, please do. We are looking at a lot of applicants, but the process in Washington is interminably slow. And even when I designate those people, it's going to take a long time before they're approved. In fact, as of today, I do not have one assistant secretary or deputy secretary that's been confirmed yet. And I've been, you know, this administration has been in existence since the 20th of January, and we do not have one assistant secretary, nor my deputy has been confirmed yet. And it's going to be several weeks and possibly months before that's done. And that process, to me, is not right. You have a new administration, and I'm not being critical of one political party or another. I think it was the same for Clinton. I think it took him almost a year after he was first elected before he got his people approved. And it's going to be it's going to be a long period of time before our people are approved in this administration. But what a loss, to have a department like Health and Social Services that's so large, that wants to do so much and is involved in so much, that we can't get our key people confirmed. And so, yes, I'm concerned about NIH and FDA, and we're looking at them. First, we wanted to get the deputy, then we want to get the Assistant Secretary of Health and some of the other Assistant Secretaries, because we're looking for researchers, and we want to get some input from some of the research organizations, so that's going to take a little bit longer. But even after we designate them, it'll be several months before they're approved. And I know General Motors would not stand still with that. Can you imagine private industry waiting that long, waiting 8 months to put somebody in place to be one of your key people? And that's the federal government. It's not the way. No, it's not right.
Is this the fault of the system itself, or is it the fault that maybe some people are dragging their feet up on the hill and don't want to approve your nominees?
I don't want to cast aspersions on anybody. I think it's the system. I think, the system, I went through the system. First, you have to fill out a heck of a lot of paperwork for the president. And then you get the privilege of having the FBI come and do a detailed background. And, they had 10 FBI agents in Wisconsin looking at me, and they even found a guy that I got into a fist fight when I was 16. And he couldn't remember who started the fight or who won, but he said nice things about me, which led me to believe that I lost the fight. And then you get a chance to go through the confirmation hearings, which require new forms. Because you're in the Department of Health and Human Services, you get the chance to go in front of two committees which wanted different forms and different applications and different things. And one wanted all the bills that I introduced, when I was a legislator and governor, and all the ones I vetoed. Well, I happened to veto more bills than all the other governors in the United States combined, so I had a huge file. And the other committee wanted all the speeches I had given. And over 35 years of speeches in public life is a lot. And I thought, what a boring job that poor clerk has to go through my speeches. And then after that, you go through the hearings, and after you get through with the hearings, you get the privilege then to go in front of the ethics department. And because the Department of Health and Human Services is so widespread, every little bit of stock that you own is a potential conflict. So you get the privilege of selling all of your stock. And I don't know if you know what the stock market has been doing. It's a great time to sell your stock, I'll tell you, to serve. And so that's the system. And the system is too long, too detailed. And I'm not blaming anybody or any party or anything. It's just the process. You should not have to go through all those steps in order to serve. And there should be a simpler way to do it. I know we don't wait that long in state government. You don't wait that long in private business. Only in the federal government does it take 6 to 8 to 9 months to get an assistant secretary or a secretary on the job.
A couple questions. Would like to know your thoughts about the Head Start program and whether perhaps it should be transferred to the Department of Education.
Well, since the President has indicated that that's where he would like it to go, I would just like to say that, the President is so passionate about improving reading in America that he wants reading to be a part of Head Start. And I agree with him. I'm passionate about it too. And I want to, since Head Start is not going to be reauthorized until another year, I want to start the reading program in Head Start this year so that maybe the President will look at it and say it still should be left in Health and Human Services. And the President, I think, will be satisfied with that, provided, the reading component is taken care of as front and center to make sure that children are not only healthy when they go to school, but are also ready and able to learn how to read when they start kindergarten and first grade. And that's a goal of both the Department of Education and the Department of Health and Human Services. So wherever it ends up, we're going to be pushing hard to make sure that kids are healthy and ready to learn to read when they start school.
Very good. Before asking the last question, Mr. Secretary, I would like to present you with a certificate of appreciation for your appearance here this afternoon at the National Press Club.
Thank you very much, Richard.
And a National Press Club mug that you can put on your desk or wherever else you would like to keep it. And the last question before you leave. If you could accomplish one thing in your current position as the Secretary of HHS, what would you like it to be?
First off, thank you very much for giving me this opportunity to speak to you. I would like America to be as healthy as it possibly can be. And that includes reforming Medicare with prescription drugs. It means getting more people covered with health insurance and getting everybody access to good health insurance and good health care in America. And it means satisfying the need for organs and marrow and tissue and blood in America so everybody on that waiting list could be satisfied. And it means giving the necessary money for research so we finally solve cancer, AIDS, Alzheimer, diabetes, and some of the other insidious diseases in America. And then in my spare time, I'll look at other things to do. But thank you so very much.
I'd like to thank all of you for coming today, and I'd also like to thank National Press Club staff members Melinda Cook, Pat Nelson, Joanne Booz, Melanie Abdel-Dermont, and Howard Rothman for organizing today's luncheon. And also thanks to the NPC Library for their research. We are adjourned.